Okay. Hi, everyone. I'm going to give it just a few seconds so we can get everybody in. Um, there we go. Okay. Well, let's start. Hello, everyone, and welcome to today's webinar regarding new requirements for methylene chloride exposure assessments. This is Janine Vaccaro, and I'll be moderating the event today. I would like to go over a couple of items before we jump into our presentation. Um, First of all, in efforts to minimize background noise, we have muted all attendees. We do really encourage questions and comments throughout the presentation using the chat box that's located on the right-hand side of your screen. And I want you to know that all questions will be anonymous, so ask away. You can also ask questions if you need any technical assistance during the webinar. And as well as submitting questions about the information that's being covered. Our presenter, Martin, is sharing a high-level overview of a very content-rich discussion. So I do want to let you know also that we will be providing all the materials, including the recording, the presentation deck, and a checklist, so you can relax and enjoy the webinar. So with that, I'd like to introduce our speaker, Martin Bermudez, Principal Consultant.
Thank you, Janine. Hi, everyone. Good morning or good afternoon, as the case may be. Pleasure to be here and be able to talk about these TSCA requirements that have recently been issued. I have been working on TSCA regulation for a little over 10 years now, and when this kind of bubbled through recently, it was significant for me because it was EPA finally kind of delving into the OSHA occupational exposures. And so I just wanted to talk a little bit about that, how it meshes with the OSHA requirements and how this all came about. I'm just going to start briefly by talking about methylene chloride and its uses and its health and environmental risk as well. And then we'll go straight into the regulatory content. So methylene chloride is it's a colorless volatile liquid. It's a sweet aroma. They say it smells like like chloroform, but I don't know what chloroform smells like. But that's what they compare it to. It's pretty recognizable smell. It's used in paint thinners, removers, adhesives, and other industrial applications. And because of its health and safety concerns, that's why the EPA has started to regulate the use of this chemical. It's a fairly volatile chemical, has a high vapor pressure, which means the most significant exposures happen through air, through inhalation. It's also a wonderful solvent. It's a very useful solvent. It solves many different materials, and that's why it's kind of ubiquitous in a lot of chemical synthesis and laboratory work. And I mentioned previously about the inhalation risks that are due to the volatility. So where do we use methylene chloride? It's used extensively in the production of pharmaceuticals, in plastics, and primarily it's been in the paint and coating industries and strippers and degreasers. So what are some of the health and environmental effects of this compound? As I mentioned previously, inhalation is the greatest exposure risk due to its volatility. It causes central nervous system effects, slurred speech, decreased alertness. It does that in both acute and chronic exposures as well. It actually causes some nervous system damage. So that's probably the biggest risk associated with the chemical. But there's also dermal effects if you have dermal exposure or eye exposure. It's an irritant and it can damage those tissues. From a chronic health perspective, it's been found, the chemical's been found to cause, again, nervous system effects over long term. It can cause personality changes, short-term memory loss. It's also highly toxic to the liver and the kidney, and it's been determined to be a carcinogen, in addition to aggravating cardiovascular conditions. In terms of the environment, it's highly toxic to fish and invertebrates in both modes of exposure. It's an air toxin that Excuse me. It's an air toxin that contributes to ozone levels and other pollution. And it's also been known to contaminate soils and groundwater from releases from industrial sites. And lastly, it's bioaccumulative, so it actually accumulates in the food chain and ecosystems where it's present. So let's talk about this mix of OSHA and EPA. I'll start out with the current OSHA requirements that have been in place for some time now. OSHA establishes safety methods to protect employees from exposure. There's ventilation, other protective measures. There's initial exposure assessment that has to be conducted, and based on that, you have to have controls. You may need a regulated area, and they establish limits, exposure limits, depending on the time of exposure. So the EPA, why is the EPA involved in this now? Well, it really has to do a lot with the Toxic Substances Control Act. This was an act promulgated in 1976 that was intended to evaluate chemical risks to human health and the environment and control their distribution and commerce to prevent damage. It wasn't very successful for a number of reasons. So in 2016, they revised the TSCA Control Act, and now we're starting to see the results of that revision. Essentially, what happened is when they did that TSCA update, it accelerated the timeline for EPA to start analyzing existing chemicals and determine their risk. And it also required the EPA to make a definitive determination whether the risk was reasonable or unreasonable. And then it also required the use of best available science when developing risk management measures. So in terms of methylene chloride's history in TSCA, in 2019, it was they actually prohibited the use of the manufacture of products containing methylene chloride for distribution to consumers. They wanted to get it out of the hands of consumers who were using it in the most uncontrolled manner, typically. So they issued that final rule in 2019, banning any consumer paint and coating removers and other consumer products that have methylene chloride. During 2020 and 2022, EPA did a formal risk assessment in a consultation process that was quite lengthy. It went through 2 rounds. And in the final round in 2022, it was determined that yes, methylene chloride posed an unreasonable risk, and they would go forth with creating measures to control exposures and limit its use. So what did they do? First, they limited its use. They limited it to only certain industrial activities, and they ruled out every other. So essentially, they identified these activities as being crucial and being able to stay in place as long as certain controls were carried out. And I've highlighted here the laboratory chemical. That's where most of our clients are seeing this impacting their laboratory R&D operations. There was, I recall in the spring when this was issued, there was a lot of academics chattering because it was affecting their laboratories, but it also affects other industries as well. So the TSCA requirements introduce this concept of a workplace chemical protection program. Essentially, it's a program for protecting employees from occupational use. The first thing they did was establish new threshold limits, which are listed here. They established an exposure limit, they established an action level that triggers controls, and they also set a short-term exposure limit. They also directly reference OSHA's regulated area requirements, so they are also they're kind of reinforcing that OSHA rule on the regulated areas for where you use this product. So as part of the Workplace Chemical Protection Program, all employers in those allowed industries need to do an initial assessment. This must be a monitoring. It can't be a theoretical risk assessment evaluation. And they are requiring this to be done by May of this year, May 5th. And in new places where methylene chloride may be introduced, it has to be created within 30 days of the introduction of methylene chloride into a work environment. Luckily for some of those labs, they did have a slight modification to the monitoring requirements in that if employees are exposed to methylene chloride for less than 30 days a year, they don't have to do the traditional industrial hygiene monitoring. They can use direct reading instruments and to evaluate work practices and determine what their concentration, what their exposure levels are. So after the initial monitoring, TSCA rules require ongoing periodic monitoring, and that the frequency of that will vary depending on the concentrations that were found in the original assessment. They can be as often as every 3 months to as long as every 5 years. EPA does have criteria for shifting between those different assessments depending on your historical data on methylene chloride exposure. And they also require, which is a little bit different than OSHA. OSHA will require an exposure assessment if the workplace changes, new methylene chloride is introduced. But the EPA also has these one-time events that trigger additional monitoring, control, a leak, loss of control, containment, rupture, or something like that. As part of after the monitoring, as part of the monitoring, they're supposed to also, employers are supposed to develop must develop an exposure control plan. These are required to be in place by October 30th for private employers. It requires you to identify the exposure controls, but unlike OSHA, it requires you to actually go through the entire hierarchy of controls and document which ones you're selecting and which ones you're not selecting and the rationale for that. So that's very different from some OSHA programs. It also, it has to spell out the actions that are being taken to implement controls, how regulated areas will be set up, how often the plan will be reviewed and updated, and also it has to have procedures for the introduction of a new source of methylene chloride or dealing with the spill. One interesting aspect as well that's different from OSHA is that they specifically do not allow personnel rotation to be used as a means of compliance. So what we typically think of as a work practice or administrative control, they're saying you cannot use that to reduce exposures. There's also notification requirements. All employees need to be notified within 30 days of exposure. Within 30 days of the start of exposure or when the plan is initially created. And that plan has to be available to employees. Respiratory protection is also being covered by the TSCA rules. This must be in place by August 1st for any work environments that exceed the exposure limits. The EPA directly references OSHA's respiratory protection requirements, but they do specify very specific personal respiratory protection depending on the level of exposure. It ranges from supplied air respirator to SCBAs and others depending on its use. So I won't go through all the details here, but you can see they kind of break it out between 2 and 50 using a supply air or airline respirator. 50 to 100, they want an in-demand mode supply air respirator or SCBA. And then in large exposures, industrial exposures, they have very specific requirements as well. It requires dermal protection, which kind of again aligns with OSHA compatible. They require it in all handling, regardless of whether a PPE assessment. They're mandating it, right? It's not part of a PPE assessment. It has to be given to any person's handling methylene chloride. And they kept OSHA's current, work clothes and equipment requirements and hygiene facility requirements that are there in terms of, availability of work clothes, laundering, and what hygiene facilities must be present for the employees to clean up. And lastly, there are training requirements, but again, they're pretty much reiterating what OSHA's methylene chloride standard says. They require the same training that uh, the OSHA standard specifies. And they also reference the PPE training as well that's required, that's already required by OSHA. So they just actually cited those directly and just reinforced the need to comply with those. So that's my summary of the changes to, or the new changes in terms of regulating methylene chloride occupational health exposures. I'm glad to open it up for questions at this time.
Thank you, Martin. That was great. We do have a few questions. So we'll start with a question about signage for the regulated area. There's recent discussion about what signage meets the intent. Can you talk to that?
So from the EPA regulatory perspective, they specifically refer to OSHA's regulated area requirement, right? So it kind of mirrors that. So the same signage that's required in an OSHA regulated area is now required by the EPA as well. Essentially, your areas may get larger if you have exposures that are above 2 ppm. Then those regulated areas may grow. Currently you have an exposure, you have a regulated area at the action limit that OSHA sets, but now you have to reconsider the EPA action levels instead and use the same criteria that you would use for an OSHA regulated area.
Okay. We'd like to know, why are the EPA's exposure limits so much lower than OSHA's exposure limits?
Part of that has to do with the age of when OSHA promulgated the regulations. I think they last updated it in 1997, if I recall correctly. And as I mentioned previously, TSCA required them to use best available science when they did the risk assessment. And the primary endpoint they used for determining those exposure levels was actually kidney and liver damage. So that was the most toxic effect from long-term exposures, and that's kind of what drove those low rates, those low limits.
Okay. Can the exposure control plan be part of an existing chemical hygiene program?
Yes, the EPA has allowed that as long as it meets the same criteria as the requirements in the EPA rule. You can incorporate it into your chemical hygiene plan.
Let's see. Are there any industries where these requirements do not apply?
So yes, so anything that's exempt from TSCA is exempt from these requirements, right? And specific industries that would be exempt are pharmaceutical. Pharmaceuticals are not covered by TSCA, excuse me. They're regulated by the FDA, and they leave that authority to them. So the pharmaceutical companies will still be able to use it. And likewise, pesticides, those are governed by the FIFRA program. And so pesticide use in manufacturing will be regulated under there. So TSCA doesn't apply to that. There's other TSCA exemptions, such as in foods that are regulated by the FDA, or or explosive or firearms regulated by the ATF. Those are some of the other exclusions, but in general, most of it is just going to be covered by this.
Okay. Is the EPA expected to issue regulations like these for other chemicals? Do you anticipate?
Yes, matter of fact, in December, they issued new risk management guidelines for TCE, trichloroethylene, and PCE, or what's called PERC commonly, in addition to carbon tetrachloride. Haven't had a chance to go and parse through those, but they're using a similar kind of setup where they have a workplace chemical control program has to be set, and they're setting lower occupational exposure limits. They've also issued less restrictive regulations. Like NMP was one material that was regulated, but they just left the work controls to, prohibiting dermal exposure, right? They didn't go to the inhalation route. So, the risk assessments that the EPA is doing kind of considers all those factors and is trying to protect, against the highest hazards as a result, and build their mandated risk management processes accordingly.
All right, thank you. Um, we're having a technical issue. Some of the questions are not being pushed to me. So I'm going to see if Jacqueline, who's behind the scenes, can turn on your mic and share those questions.
Yes.
Thank
All
you.
right. Let me see.
Thank you, Jacqueline. To the
No
rescue.
worries. Um, okay, can you elaborate on the exemptions to initial monitoring for researchers if exposed to DCM is less than 30 days per year with two conditions. Number one, direct reading measurements must be taken in the environment to ensure levels are below both 1 pp8 and 16 ppm. I know this is a long one. I think I might just message this one over to you, Martin, because this one's pretty
Okay.
long.
So yeah, I think I get the gist. So as I mentioned before, they are allowing you to use direct read instruments to do that. Uh, I have seen portable mass spectrometers that can do this. They're very expensive pieces of equipment, but there may be other methods that can be used by an industrial hygienist that I'm not aware of, uh, to monitor methylene chloride directly. Um, but when I first saw this requirement, I had never seen a direct reading instrument for methylene chloride before, my experience, and other than the mass spec. And essentially, they're allowing you to take those measurements to determine, kind of define your regulated areas and determine whether you're above those exposure limits or not. So they're not subject to the exact, analytical standard requirements that are part of the industrial, that are, typically done in industrial hygiene for, routine exposures.
Thank you. Okay, and then where does the line between exempt pharmaceutical industry use and regulatory laboratory research lie?
I'm not sure if the EPA has issued guidance in that. I think uh, in my mind, the line, and again, I haven't seen EPA guidance on this. My line on that would be once you're kind of going into production, I think that's when the exemption would kick in. You'd really have to kind of look at the scope of FDA's reach into the process. Yes, they have requirements on research in terms of moving things through clinical trials and whatnot. Um, but that's a very good question, and I think it's to be determined, right? There's some argument you can make that it could be all research and development activities, since you're all producing a pharmaceutical product as an end result. Um, but again, like I said, I haven't explored this, and EPA, to my knowledge, hasn't issued any guidance on it yet.
Perfect. Okay, and then do you expect the new administration to use current legal changes to methylene chloride rule as an opportunity to reprimand and revise it?
Yes. So there, the reason why a lot of these rules came out was they were rushing to get a lot of them done before a potential change in administration. They're allowed within 60 days prior to the inauguration of a new administration, those regulations can be revoked, right? And they're in the process of doing some of that right now. But the methylene chloride one was issued much more before that. So it's my understanding that they would really have to go and re-legislate or go through an entire new rulemaking process to strike the methylene chloride down. In general, in risk assessment, this is part of the chemical industry's uh, uh, you know, it's their legal way of getting things onto the market, and that law isn't going to change. But what I would anticipate is that the pace of the risk assessments might be slower. They're probably with the new the Chevron doctrine ruling. There will be a lot more legal challenges, and so I'd expect things to slow down. But this is a process. This risk assessment process is kind of fairly ingrained. I don't, you know, so I don't think it's going to have a huge change. It is just slow new work in this area.
Okay. Since we do not know if researchers are going to use the DCM before the deadline date, does it mean we still need to complete the monitoring before the deadline? If so, can we just do a mock experiment run in place of the experiment?
So if you're not using methylene chloride presently, um, essentially you have 30 days from the time that you use it to implement the work, the WCCP. So that would be the time frame where you're doing the initial monitoring and determining what restrictions, if any, apply to your work. Again, I think you can model it, I suppose, if you can, document how that's similar to the future use condition, if you want to get that out of the way ahead of time. I certainly think that's possible, as long as it's well documented that it's representative of the activities, of the future activities.
All right, and I think that is about all the questions. If anybody has anything else, feel free to add some more, but I'm not seeing any new ones coming through. Oh, I have one. What gloves are compatible with DCM?
I would have to I don't know that off the top of my head. I will definitely have to look at a compatibility chart. So we can definitely add that to the information we send out later. So apologies, I don't know that off the top of my head.
Okay, one more. Any information you can touch on related to fume hood, open and closed paint booths related to methylene chloride?
So again, it depends on the industrial uses are now limited, right? So first of all, you would have, in order to continue to use methylene chloride, you would have to be one of those allowed industries that was mentioned previously. And then in that case, you build your workplace controls as befits your operations. So you would evaluate whether ventilation is sufficient. You would, doesn't change, the need to protect employees. It just will lower the exposure limits and possibly the work practices and other controls that you might have to put in place. I'm not sure if painting activities, again, it depends on what, if they're related to the industries that are allowed, then yes, but if it's, paint activity that's not really an allowed use, then it's prohibited.
All right, and then where can I find information or subscribe to notifications on the new chemicals being regulated by TSCA?
The EPA does have a list, a mailing list that you can sign up for their Office of Pollution Prevention and Technology, I believe it is. And they're also always published in the Federal Register, obviously. So there's regulatory services where that may be available. You can look at those. But typically, I just keep my eyes peeled to the press. I follow legal events and update myself with some of those EPA newsletters.
Okay, fantastic. Thanks for jumping in, Jacqueline. Thanks to everyone for all your great questions. If you think of any additional questions, you're free to contact us using the emails on the screen. Um, and with that, I'd like to thank everybody for attending today's webinar. Please look out for a follow-up email within the next few days, which will include a link to access today's webinar recording, a PDF of the presentation, as well as a methylene chloride checklist. Thank you again for attending. We're right on time. Have a wonderful day. Bye.
Thank you.